Second white coat. Subscribe and like. Let's learn medicine together.
All right, welcome to The Explainer. Today, we're going to unravel a condition that, often gets confused with Alzheimer's, but it's a totally different beast, vascular dementia. So let's jump in and see how doctors play detective to figure this one out. It often doesn't start with some big dramatic event. It's more like these small, little changes that start to worry you. Let's take this case of a 74-year-old man. His family started noticing his world was just getting more and more confusing. So let's look at the very first clues they brought to the clinic. So where do you even start with something like this? Well, it's not with some fancy high-tech scan. Nope. It starts with the people who know him best. The very first clues, they came straight from his family. So his family comes in and they report this really fast decline. We're talking just 6 months. All the skills he'd used his entire life were just slipping away. He couldn't handle his finances anymore, couldn't plan his day, and get this, he was getting lost in his own neighborhood, places he's known for years. So you see, this is way more than just being a little forgetful. We're talking about a fundamental breakdown in his ability to just function. Okay, so they run some tests at the clinic, and yep, it confirms exactly what the family was seeing. The big issue here wasn't just memory. It was this major problem with what's called his executive function. Think of that as the brain's CEO, right? The part that plans, organizes, and gets things done. And the fact that this was the problem, well, that was a huge clue. All right, so we know what's happening. The big question now is why? And to answer that, we've got to look inside the brain and find the actual physical evidence. So the next step is a brain scan, an MRI, to be specific. It's designed to light up any areas that might be damaged. And this is the big moment, right? What is it going to show? Are we going to see the kind of brain shrinkage you might expect with something else, or is it a completely different story? And sure enough, it was a different story. Instead of that widespread brain shrinkage you see in Alzheimer's, the scan lit up with these scattered bright spots. Doctors call them hyperintensities. You can basically think of them as tiny little warning lights flashing, hey, damage here. Now, their location is absolutely crucial. They're not just anywhere. They're concentrated in the brain's deep white matter. That's like the wiring, the cables that connect all the different parts of the brain. And that pattern, that's a massive clue. Okay, so we've got the symptoms on one hand and these bright spots on the MRI on the other. How do we correct those dots? Well, this is where the diagnosis really starts to take shape. The reason for those bright spots has a name, ischemia. Basically, it's like a massive traffic jam happening in the brain's tiniest blood vessels. Blood flow gets choked off, so oxygen and nutrients can't get where they need to go. And over time, that brain tissue just gets starved. That's the physical damage we're actually seeing on the scan. This really lays out the whole thought process step by step. So you've got step 1, the symptoms, right? The main problem is that executive function breakdown. Then, step 2, you've got the MRI, which shows all that scattered damage from ischemia. You put those two things together and bam, step 3, you've got your diagnosis, vascular dementia. But why? Why does this specific kind of damage lead to those specific symptoms? Well, it's because it's messing up the brain's internal communication lines, specifically what we call the frontal subcortical circuits. Remember that brain CEO we talked about? It's like someone went in and cut the phone and internet lines to the CEO's office. The CEO, our executive function, is still there, but it can't communicate. It can't send out the memos to plan, organize, or tell the rest of the brain what to do. A good diagnosis isn't just about finding what fits. It's also about proving what doesn't fit. Doctors have to be detectives here and rule out the other suspects that could be causing these symptoms. Okay, first up, the most common comparison, Alzheimer's. And the key difference is what goes wrong first. With vascular dementia, like we've seen, it's that CEO, the planning and organizing. But with Alzheimer's, it usually starts with episodic memory, like forgetting a conversation you just had. And this difference shows up perfectly on the MRI scans. You get scattered damage in one, and in the other, you get that brain shrinkage, especially in the memory centers like the hippocampus. Two totally different pictures. All right, what about something else that causes spots on the brain, like, say, cancer that's spread? Yeah, they can cause similar problems for sure, but the MRI tells a totally different story. Brain metastases look like actual masses, often with swelling around them. That's a world away from the scattered, patchy damage we're seeing from the ischemia. And one more to rule out, multiple sclerosis, or MS. Now, MS also creates lesions in the white matter, but the reason why is completely different. See, MS is an inflammatory disease where the body's own immune system attacks the nervous system, and it typically shows up in younger people. That's just fundamentally different from the blood flow problem, the ischemic injury that we see in older adults with vascular dementia. So, after we've followed all the clues and ruled out all the other possibilities, what are we left with? We have a really clear profile of this condition. Let's just wrap up the key points from this whole journey. So, let's nail down the core profile of vascular dementia. First, it hits executive function hardest. It's not primarily a memory problem, at least not at first. Second, the decline isn't always smooth. It can happen in these sudden, noticeable steps. Third, the cause is totally physical. It's all about that built-up damage from poor blood flow. And finally, you can see it on the MRI. Those little bright spots are the smoking gun, showing us exactly where the brain's command and control wiring is getting fried. Okay, if you're going to remember just one thing from all this, make it this next part. It's a super simple but really powerful little equation. This is it. This is the heart of the diagnosis. You take the clinical symptom, that breakdown of the brain's CEO, and you add the physical evidence you see on the MRI, those scattered ischemic lesions. That simple formula is what solved the mystery for our patient. But it does more than that. It really gets to the core of what vascular dementia is. And it's a pretty powerful reminder, right? That what's happening inside our blood vessels has a huge, direct impact on how we think, how we function, on everything.